Have you ever wondered what a stroke is? Have you ever questioned if you'd be able to tell if someone around you was having a stroke? According to the CDC, strokes are the number 5 cause in deaths in America. Today, I'm going to teach you how to recognize a stroke and inform you about the 3 most common types of strokes in America. For those of you that don't know me, my name is Amy. I'm a paramedic. I've been a paramedic for a little over 10 years. During my rotation at work, I'm at work on average 48 to 72 hours a week. During that time, I run at least 2 stroke patients that are actively having a stroke. I'm also certified ASLS, which stands for Advanced Stroke Life Support. We get certified every 2 years. That helps us determine where in the brain that the patient is having a stroke. It's important to know how to recognize a stroke and also the different types of strokes. The 3 most common ones are an ischemic stroke, a hemorrhagic stroke, and TIAs, or transient ischemic attacks. Recognizing that a person is having a stroke is the key to being able to identify it and to save that person's life. A stroke is when the blood that has been carried through a vessel either forms to a clot in the neck or the brain, or it ruptures in the brain, causing lack of oxygenation to the brain in the area where the stroke occurs. Those parts of the brain then become dead tissue, and it can cause a multitude of neurological deficits. There are signs and symptoms of strokes that mimic strokes, like low blood sugar, brain tumors, low sodium, but always err on the side of caution and seek medical care. According to the American Heart Association, using the FAST acronym is the best way to tell if someone is having a stroke. FAST stands for, F stands for face. You will have someone having a facial droop on either side of the face. They won't be able, when they smile, only one side of their face will go up, the other will stay down. Usually on that same side, their whole side will have some deficits to it. The A stands for arm drift. So you're going to have a patient put their arms out in front of them, hold their hands up, and close their eyes. If their arm drifts, that is a sign that they could possibly be having a stroke. The third, S, stands for speech. Sometimes people that are having strokes have a hard time speaking. Their words can become babbled, or they just can't get the words that they're trying to get out. And the T is for time. That means it's time to call 911. So remember, F-A-S-T, face, arms, speech, and time. Now that you've been informed on how to recognize a stroke, I want to explain the 3 most common types of strokes. According to the National Institute of Neurological Disorders and Strokes, nearly 80% of all strokes are ischemic strokes. An ischemic stroke is a blockage or a clot somewhere in the neck or the brain in a blood vessel, causing that specific part of the brain to lose its oxygenation. If an ischemic stroke is caught within a certain period of time, according to the Mayo Clinic, there is a medication that can be given to that patient that can break up that clot. It's called TPA. That, again, is where time is of the essence. Now that you've learned a little bit about ischemic strokes, which is a blockage, I will now explain a hemorrhagic stroke, which is the rupture of a vessel. So the second most common type of major stroke is a hemorrhagic stroke, making up of about 13% of strokes according to the American Heart Association. A hemorrhagic stroke is when a weakened blood vessel ruptures, causing bleeding into the brain. It could be in the brain, which is called an intracranial bleed, or it can be between the brain and the skull, which is called a subdural bleed, and that actually puts pressure on the brain instead of the lack of oxygenation. It's pressure squeezing onto the brain, according to the American Heart Association. The Mayo Clinic advises that there are treatments for hemorrhagic strokes as well. They are able to go in and suction out the blood that is there, relieving the pressure off of the brain, or they can also give medications to help slow the bleeding down. Now that you know the difference between the 2 most major types of strokes, we're going to talk about the third most common type of stroke, a TIA, a transient ischemic attack, also known as a mini stroke. A TIA is the warning sign for future strokes, according to the CDC. TIAs do not usually last for very long. They only last for about 5 minutes. People have the same symptoms as a major stroke, but then those symptoms resolve. Patients feel that 5 minutes of something that is abnormal happening, they think that once it resolves that they're okay. But according to the National Institute of Neurological Disorders and Strokes, it is very important that you seek a medical care immediately for that, because it's an underlying cause that is causing the stroke, and in the long run you will end up having a massive stroke and you could ultimately die. So today I've given multiple facts about strokes. You should all know how important it is to recognize a stroke. Remember your FAST, F-A-S-T, and then you should also know a little bit about the 3 most common types of stroke, which include ischemic stroke, hemorrhagic stroke, and TIAs. Now maybe that you know the signs and symptoms and the 4 simple steps of a test, you will be able to recognize when someone is suffering from a stroke and act fast. Remember, always err on the side of caution and call 911 if you see anyone having these types of symptoms. It is really important to know about strokes, even if it's just the basics that I've taught you today. And remember, if you act fast, you could literally be saving a life.